Thanks, Kelly. Well, a Tigard-based global health organization is inviting you to hear the stories of refugees, displaced people, and the host communities they serve.
Medical Teams International works to foster hope and healing for millions of people fleeing hardship. So joining us now to show their mission and how you can help, we have Chief Developmental Officer Tricia Caldwell here this morning. Good morning. Appreciate your time.
Thank you so much for having me.
Yeah, it's great to have you here. I know we did a quick little summary there, but dive a little bit more into what Medical Teams International does.
Yeah, we provide loving, life-saving medical care to people in crisis all over the globe. We currently work in 7 different countries around the world, including here in the Pacific Northwest. And we provide primary health care, basically. And this is the difference between life and death for so many people. So many people fleeing war, famine, just really, really incredible hardships that they're facing, and we're so blessed to be able to come along and serve them.
Absolutely. And there are situations all around the world that sadly just do not get, coverage on the news every day necessarily,
Right.
but over 120 million people and growing, according to the UN, in terms of populations that are fleeing violence and conflict right now. It's a pretty staggering statistic. What exactly are you able to do for these communities?
Yeah, I mean, we provide primary health care, so that includes vaccinations, pediatric care, maternal care. Every 10 minutes, we're delivering a baby somewhere around the world. Every 13 seconds, someone is receiving care in our clinics. So that is the difference between life and death, and it also includes mental health. These are people that are fleeing horrific wars, people just like you and me that are leaving their homes, their livelihoods, their careers, and we are just really blessed to be able to be in those moments of heartbreak and come alongside them and hopefully bring them along in healing.
Yeah, it's critical work. And with that said, we can all help. There's a fundraising gala that's coming up on Friday in Portland. Tell us about what is happening with this gala and where exactly this money goes toward. That does get raised from this.
Yeah, thank you so much. We're really excited about this gala on Friday. It's actually a sold-out event, which we're so excited about. We'll be celebrating with our donors, the amazing work that they've done. This last year, Medical Teams was able to provide access to health care for 9.6 million people across the globe.
Wow.
So we'll be celebrating that and all the amazing achievements there. But even though it's a sold-out event, doesn't mean that you can't come along too. So you can help provide access to healthcare as well.
And I think, in getting to hear some of the stories from people like yourself who've been on the ground, who've been doing this work. You recently visited some of the Medical Teams work sites in Ethiopia and Uganda. Tell us a little bit about what you saw there, some of the stories that folks are going to be able to hear this week.
Yeah, it was a beautiful trip, certainly very hard and something that I'm still processing. But I got to meet some of the most amazing people. I actually met this young girl, 16-year-old Meza. And she fled the war in Khartoum in Sudan. Some of these people are actually walking the distance of Portland to Boise to find safety.
Oh my goodness.
And then they're coming into our care, and we do immediate screenings. We will check them for malaria, malnutrition. We'll make sure they're vaccinated and they have the basic care that they need to continue thriving. And they'll be in these camp settings for anywhere from 4 to 6 weeks before they go into settlements and they start to rebuild their lives. We are still with them after that as they continue to find their way. And some of it is the mental health services that we provide, because as you can imagine, when you're fleeing war, your whole life is ripped from you in an instant.
Yeah. There's so many things beyond just the physical injuries that you might see being treated in a hospital that comes along with it. And that being said, too, we're seeing so many changes right now in our country at the federal level in terms of funding, and that has made this mission a little more difficult for you to continue.
Yeah, it has been challenging over the last 8-9 weeks. As an industry, the nonprofit sector has been picked up, shaken about, and thrown back down. We are very blessed to have amazing individual donors, just like you and me, that have come alongside for years. We've been part of this mission since 1979. And we have been able to sustain that because of individual donors. We're incredibly grateful for the financial support that the government provides as well, but there's still a lot of chaos around that and uncertainty. And what we know is that most likely in the future, those grants will continue to decline. So that provides an opportunity for even more people to come along in this mission, because we know that primary health care is incredibly important. It is basic to our ability to thrive.
I mean, and again, you're doing it worldwide with people who wouldn't have it otherwise. It's
Right.
it's critical. We so appreciate your time here on
Thank you
AM
so
Extra. And you
much.
did mention there are still ways for people to help. This is how we're going to put this number on your screen to call for donations. It is 503-624-1000. There's also the email there. You can email donations@medicalteams.org. And of course, there's that big QR code. So I'm going to speak a little bit slower in case you are trying to pull out that smartphone, scan that QR code if you want to help Medical Teams International continue to do the work that they do. It's critical. We're also going to post all of this right now on coin.com.
Absolutely. Thank you so much for being here.
Yeah, appreciate your
This is
time.
Thank you.
Wonderful
Thank you.
mission. Yeah. It is 7:40.